Hello, my name is Michelle Sasson, and today I'll be performing your assessment. Prior to this, we've taken your vitals, and your blood pressure is 118/72. Your heart rate is 64 beats per minute. Your respirations are 18 breaths per minute, and your temperature is at 97.1 degrees Fahrenheit, with your height at 5'6" and your weight at 178, bringing your BMI to 28. First thing I'm going to have you do is I'm going to have you stand, and we're going to take a look at the Snellen chart here. I'm going to have you cover your left eye, and if you can read off the smallest
LTFPH.
Okay, and if you can cover the other eye and read off the smallest line.
LTFPH.
Okay, very good. Now inspecting your head and your hair, I see that your hair is straight, dark, and it is normally evenly distributed throughout. I'm going to palpate your head, and you're going to let me know if you have any tenderness.
No.
Okay, I don't feel any lesions either. Very good. And so what I'll do now is I'm going to assess your facial symmetry. So if you can smile for me. Okay, and let's see your teeth again. Okay, very good. Give me a sad face. Very good. And then let's puff up those cheeks. Very good. And raise your eyebrows. Okay, and close your eyes tightly. Okay, very good. So it looks like cranial nerve 5 and 7 are intact. Now I'm going to palpate your temporal artery for elasticity and tenderness. Do you have any tenderness?
No.
Okay, very good. Now I'm going to palpate your temporal mandibular joint. If you can open and close your mouth. Very good. Can you move your jaw from left to right? Okay, very good. Now I'm going to palpate your carotid arteries. Okay. And I'm going to auscultate your carotid arteries as well, using the bell of my stethoscope. Okay, now breathe. Very good. Now breathe. Okay. Now I'm going to palpate for your lymph nodes. I'm going to start here at your preauricle lymph nodes. Okay. I'm going to feel back here for your posterior auricle lymph nodes. Okay, your occipital. Okay, and then we have the jugular, distal gastric, submantle, submandibular. Okay, we have your superficial cervical. Okay, I'm just going to tilt your head over here for your deep cervical. Okay, this side too. Alright, posterior cervical. Okay, now I'm going to check your supraclavicular. Okay. Your lymph nodes are non-palpable, and that's a normal sign. Now I'm going to check your neck, and I can see that there are no lesions. Your head is midline on your shoulders, and these are all normal findings. I'm going to check the range of motion to your neck, so if you can bring your chin down to your chest. Okay, very good. Back up. And now if you can turn your head from left to right. Okay, very good. And extend it backwards. Okay, very good. Now I'm going to palpate your trachea. So I'm going to have you tilt your head here. Very good. Okay. Very good. Your trachea is midline. Now I'm going to feel for your thyroid gland. So I'm going to have you swallow. Okay, very good. And swallow again. Okay, so your thyroid gland is not enlarged, but if it was enlarged, we would auscultate it for bruit. Now I'm going to check your cranial nerve 5 facial sensations. So I'm going to touch you with a blunt object and a dull object. Okay? I'll have you close your eyes, and if you can just let me know which one you feel.
Dull. Blunt. Dull. Blunt. Dull. Blunt. Blunt. Dull. Blunt. Dull. Blunt.
Okay, very good. Now we're going to move on to your eye assessment. So first thing I'm going to have you do is I'm going to check your extraocular movements, and by that I'm going to have you follow my finger. Do not move your head, just follow it with your eyes. Okay, very good. Now we're going to check your peripheral vision. I'm going to have you cover your right eye, and you're going to let me know when you can see my fingers come into view. Okay?
Yes, into view. Yes. Yes.
Okay, very good. Keep it there.
No, yes. No, no, yes. No, yes.
Okay, very good. Now I'm going to check your sclera of your eyes, and from what I see that they are white and they're clear. I'm going to assess your eyelids, which they look non-inflamed. Your eyebrows are intact. Your eyelashes are also intact. I'm going to pull down your eyelids here. Okay, your conjunctiva is clear with no drainage or discharge. I'm going to apply a little pressure here. Okay, your lacrimal ducts are non-obstructed. So what I'm going to do now is I'm going to check your pupillary reaction with my pen light. Okay, I'm going to have you take a look over here towards my ear, and I'm going to shine the light in your eye. Okay? Good. Okay, you're going to look this way here. Okay. Very good. Your pupils are equal, round, and reactive to light. Now I'm going to check your accommodation and your convergence. So if you can take a look at this pen light here, follow it with your eyes. Okay, very good. Your eyeballs do converge. Okay. Now what I'm going to do is I'm going to use my ophthalmoscope, and we're going to take a closer look into your eye. I'm going to get close to your eye, so try not to move. First, I have to find the red reflex. Okay. Okay, very good. Okay, and now I am assessing your optic disc shape, color, and margin. I'm also assessing your retinal vessels, and your fundus has no lesions, it's intact, or with no obstruction, and assessing your macula. Very good. And I would do that